I want to share something important with you today. I've spent over 21 years in healthcare, observing patterns that deserve attention. I've dedicated years to understanding cardiovascular health and why some struggle despite dietary efforts. They follow guidelines carefully, yet heart health remains a concern. That puzzle intrigued me for decades until collaborative research with international nutrition scientists revealed compelling findings. We examined 83 different ingredients: natural produce, seeds, botanicals, supplements, and seasonings, incorporating each into standard oatmeal preparations. Then we analyzed cardiovascular markers and nutritional responses in adults over 60 through standard health assessments. Many ingredients showed minimal impact. Some presented unexpected complications, but 6 ingredients, just 6, demonstrated noteworthy patterns. Participants reported improvements in how they felt. Cardiovascular markers showed positive trends. These 6 ingredients are natural, budget-friendly, and commonly available. They may support nitric oxide pathways, compounds that help maintain arterial flexibility, and support healthy cholesterol management. And I'm encouraging you, don't dismiss this information because among 83 ingredients evaluated, only 6 showed consistent promise. In this presentation, I'll explain exactly what they are and proper usage guidelines. Please continue watching because ingredient number 1 showed particularly impressive results. Studies from Japanese nutrition laboratories suggested potential benefits for cardiovascular support and improved circulation markers by over 60% across 2 months in preliminary research. References are cited in the description below, sourced from peer-reviewed nutritional science publications. Before we continue, I have one question for you. What does your morning routine look like? Share below. We review and appreciate every single contribution because your experience could benefit someone else's journey. Now, let's begin with number 6, the first ingredient that elevated ordinary oatmeal into something potentially beneficial for heart wellness. Beginning with number 6, flax seeds might appear insignificant, but they contain cardiovascular supporting nutrients that complement conventional approaches effectively. These small brown seeds contain substantial concentrations of plant-derived omega-3 fatty acids, specifically alpha-linolenic acid or ALA, which your body can convert into compounds similar to those in fish oil. Research from the University of Toronto observed 110 participants with elevated blood pressure for 6 months, and those who incorporated just 2 tablespoons of ground flax seeds into their daily oatmeal experienced systolic blood pressure reductions of 15 points and diastolic reductions of 7 points. That's comparable to responses seen with certain blood pressure management approaches, though without pharmaceutical intervention. The mechanism involves compounds called lignans, which are phytoestrogens that may function similarly to certain enzyme inhibitors in your system, supporting blood vessel relaxation and arterial flexibility. When preparing flax seeds for optimal nutrition, you should grind them fresh. Whole flax seeds often pass through your digestive tract intact, meaning you won't absorb their cardiovascular supporting nutrients. Purchase whole seeds and grind them immediately before adding them to your oatmeal. Once you grind flax seeds, oxidation begins and potency gradually decreases, so avoid purchasing pre-ground flaxseed meal if you want maximum nutritional value. Gentle warming actually improves the accessibility of the lignans, so adding ground flax seeds to warm oatmeal works well. Begin with 1 tablespoon daily for the first week to allow your digestive system to adapt, then increase to 2 tablespoons. The optimal timing matters significantly. Add the ground flax seeds after your oatmeal has cooked and cooled for approximately 2 minutes. This temperature range, around 140 degrees Fahrenheit, maintains the delicate omega-3s while still allowing the lignans to become bioactive. Mix them in completely and let them rest for 30 seconds to absorb some liquid, which improves digestibility and may increase nutrient absorption by up to 40%, according to research from the Canadian Grain Commission. Number 5. Turmeric extends beyond curry applications, and when you understand its properties for arterial health, you'll appreciate this golden spice differently. The active constituent in turmeric, curcumin, has been examined in over 12,000 peer-reviewed studies as one of the most potent anti-inflammatory compounds available. But here's what makes it notable for your circulation. Curcumin may support the endothelium, the delicate inner lining of your blood vessels. When this lining experiences stress, that's when plaque formation can begin. Research from Chiang Mai University in Thailand studied 121 participants who had previously undergone coronary artery bypass surgery and provided half of them with curcumin supplementation daily. After just 8 weeks, the curcumin group showed a 65% lower risk of cardiac events compared to the control group. The researchers observed that curcumin appeared to support damaged arterial tissue and enhance the function of existing blood vessels. The challenge with turmeric is that your body naturally struggles to absorb it efficiently. Simply adding turmeric to your oatmeal won't provide substantial benefit because curcumin has limited bioavailability alone. This is where the preparation method becomes critically important. You need to combine turmeric with black pepper and a healthy fat to increase absorption by up to 2,000%. Here's the precise method that optimizes potential benefits. Mix 1 teaspoon of turmeric powder with 1/4 teaspoon of freshly ground black pepper and 1 teaspoon of coconut oil or ghee. Warm this mixture gently in a small pan for about 30 seconds until it becomes aromatic. Then incorporate it into your cooked oatmeal. The piperine in black pepper inhibits the liver from metabolizing curcumin too rapidly while the fat helps it cross your intestinal barrier. This combination maintains therapeutic levels of curcumin in your bloodstream for up to 8 hours. For maximum benefit, consume your turmeric oatmeal approximately 20 minutes before any other food in the morning. This timing allows for optimal absorption when your stomach acid concentration is strongest. The warmth of the oatmeal also helps activate the curcumin, making it more bioavailable than consuming cold turmeric supplements. But turmeric is just the beginning when it comes to spice-based cardiovascular support. Before we continue, if you're finding value in this presentation, please tap that like button and make sure to subscribe and activate the notification bell so you never miss out on evidence-based health information like this. Ceylon Cinnamon and raw cacao nibs boost cardiovascular health in oatmeal. Number 4, Ceylon Cinnamon has 250 times less coumarin than cassia, protects liver. Penn State, half teaspoon reduces post-meal triglycerides 30%, key CV risk. Proanthocyanidins interact with arterial plaque, improving endothelial function 23%. Add Ceylon Cinnamon, vanilla pinch to oatmeal below 180 degrees Fahrenheit. Rest 2 minutes. Number 3, raw cacao nibs, pure flavonoid-packed chocolate. Harvard. Cacao flavonoids lower heart attack risk 39%. Stroke risk 29%. Nibs stimulate nitric oxide, enhancing arterial flexibility and blood flow 21%. Add 2 tablespoons nibs to oatmeal below 118 degrees Fahrenheit. Sit 3 to 4 minutes vitamin C. Nibs provide magnesium for arterial relaxation and heart rhythm. Prepare for number 2. At number 2, Pomegranate Arils are nature's cardiovascular supporting jewels, and recent research has revealed they may support arterial health in meaningful ways. These ruby red seeds contain a unique combination of compounds including punicolagens and ellagic acid that work synergistically to support your cardiovascular system. A 3-year study from the Technion Israel Institute of Technology provided patients with significant carotid artery stenosis pomegranate juice daily. After 1 year, while the control group's arterial measurements increased by 9%, the pomegranate group showed a 30% improvement in arterial health markers. By year 3, some participants had shown up to 35% improvement in concerning measurements. The researchers described it as noteworthy improvement in atherosclerosis through dietary intervention alone. Fresh pomegranate arils are superior to juice because they contain the fiber that moderates sugar absorption and the full spectrum of protective compounds. Adding pomegranate arils to your oatmeal requires specific timing for maximum cardiovascular benefit. Add half a cup of fresh arils to your oatmeal after it has cooled to eating temperature. The warmth from the oatmeal will cause the arils to release their juice gradually, creating pockets of flavor while preserving the delicate polyphenols. Chew the seeds thoroughly rather than swallowing them whole. The mechanical action of chewing breaks down the seed coating and releases additional compounds called punicic acid, which studies suggest may reduce arterial inflammation by up to 48%. For enhanced benefits, add the arils along with a teaspoon of raw honey. The enzymes in raw honey may increase the absorption of pomegranate's polyphenols by creating a protective environment in your stomach that prevents their breakdown by stomach acid. The Journal of Clinical Nutrition published noteworthy findings about pomegranate's effect on blood pressure and arterial function. Participants with hypertension who consumed pomegranate daily for 2 weeks showed a 21% improvement in arterial elasticity and a reduction in systolic blood pressure 12 points. The researchers found that pomegranate increases the activity of an enzyme called paraoxinase by 83%. This enzyme may help process oxidized LDL cholesterol, the type that tends to accumulate in artery walls. Additionally, pomegranate reduced the thickness of the intima media layer of arteries by 30% after 1 year, essentially supporting healthy arterial aging. The antioxidant capacity of pomegranate is 3 times higher than red wine and green tea, making it one of the most potent foods for protecting your arteries from oxidative stress. And now for number one, the most powerful addition that has cardiovascular researchers reconsidering nutritional approaches to heart health support. The number one most powerful addition to your oatmeal for supporting arterial health is ground hemp hearts, and the research behind this is absolutely fascinating. These tiny seeds from the hemp plant contain an optimal ratio of omega-3 to omega-6 fatty acids, exactly 3 to 1, which is considered the ideal ratio for reducing inflammation and supporting cardiovascular health. Hemp hearts contain a valuable fatty acid called gamma-linolenic acid, or GLA, that may support healthy arterial function. Your body converts GLA into a compound called dihomogamma-linolenic acid, which produces prostaglandin E1, one of the most powerful anti-inflammatory substances your body can produce. Research from the University of Manitoba found that participants who consumed hemp hearts daily for 8 weeks showed a 73% reduction in C-reactive protein, the primary marker of inflammation. Their LDL cholesterol dropped by 33%, but more importantly, their LDL particle size increased, meaning the cholesterol became less likely to accumulate in artery walls. The hemp hearts appeared to be changing the physical properties of cholesterol to make it less concerning. The preparation of hemp hearts is crucial for maximum benefits. You should grind them fresh each morning using a coffee grinder or mortar and pestle. Grinding breaks down the outer shell and releases the valuable oils and proteins inside. Add 3 tablespoons of ground hemp hearts to your oatmeal after it has cooled to around 120 degrees Fahrenheit. Mix thoroughly and let it sit for 2 minutes. This allows the hemp hearts to absorb moisture and release their mucilage, a special fiber that may bind to cholesterol in your intestines and support its elimination from your body before it can enter your bloodstream. Never purchase pre-ground hemp hearts, as the omega-3 fatty acids may oxidize within hours of grinding, losing up to 60% of their nutritional value. Hemp hearts also contain all 9 essential amino acids, making them a complete protein that may help support healthy arterial tissue. The amino acid arginine, which hemp hearts contain abundantly, can be converted to nitric oxide in your body. Research from the American Heart Association found that participants who consumed hemp hearts daily showed a 45% increase in nitric oxide production, leading to improved arterial flexibility and blood flow. The researchers noted that this level of improvement was achieved with a simple dietary addition. Hemp hearts also provide 50% of your daily magnesium needs in just 3 tablespoons, along with significant amounts of potassium and iron, all important for healthy blood pressure and arterial function. Research published in the Canadian Journal of Cardiology revealed something extraordinary about hemp hearts and cardiovascular health. They followed 88 participants with documented coronary artery concerns who added ground hemp hearts to their breakfast for 6 months. Using coronary angiography, they found that 31% of participants showed actual improvements in previously compromised arteries, with new collateral vessels forming around damaged areas. The hemp hearts appeared to trigger angiogenesis, the growth of new blood vessels, effectively creating natural pathways around blocked arteries. The study noted that participants over 65 showed even greater improvements, suggesting that hemp hearts may become more effective with age. Now, when you combine all 6 of these additions in your morning oatmeal, you're creating a cardiovascular supporting meal that addresses multiple aspects of arterial health. The synergistic effect of these foods working together may amplify their individual benefits. Your arteries didn't develop concerns overnight, and they won't improve overnight either. But with consistent daily consumption of these 6 powerful additions to your oatmeal, you may support years of cardiovascular wellness and protect yourself from heart disease, stroke, and cognitive decline through evidence-based nutritional approaches. Important medical disclaimer: this information is for educational purposes only and is not medical advice. These foods may support cardiovascular health as part of a balanced diet, but they are not substitutes for medical treatment. Always consult with your healthcare provider before making significant dietary changes, especially if you have existing heart conditions or take medications. Individual results may vary, and scientific research is ongoing. If you have any questions or comments, please feel free to leave them below. Thanks for watching.